Meet our patient, Mr. Smith, an 80-year-old man who fell over his granddaughter's bike at Easter and sustained a skin tear on his right forearm. Today, our group of nursing students will provide patient education on wound care, including how to cleanse and dress the wound, signs and symptoms of infection, and when to seek medical care. We will also demonstrate therapeutic communication skills such as active listening and empathy to promote a patient-centered approach to care.
Before we start, let's review Mr. Smith's medical history and current medications to ensure we provide safe and effective care.
Perfect. So according to his medical history, he's taking a blood pressure medication and he has a history of diabetes. So we need to be mindful of those conditions before we teach him how to treat his wound.
Additionally, we should assess Mr. Smith's literacy and just to make sure that we're providing adequate education that's within his realm of understanding.
Alrighty. Hello, Mr. Smith, can we come in?
Of course.
Awesome.
Hi, how are you feeling today?
Good. My arm hurts a little though.
I'm sorry about that.
I'm so sorry about that.
I'm Katie and this is Jenna. We're going to be your nurses today.
Okay.
Thanks for letting us help you. We're going to show you how to dress and change your wound and what to look for infection and anything like that so you feel up good, okay?
Okay.
Alrighty. So we know that the doctor went over it a little bit with you. Do you remember what he said by any chance, or should we just refresh it all for you?
I remember a bit, but not a ton.
Okay, we will go through all of it for you. So first, we're gonna get some mildly hot, not super hot, just lukewarm water and a little bit of soap, okay?
Okay.
Alrighty, so the first thing we're gonna wanna do is you're gonna wanna wash your hands nice and clean. You're gonna get some water and some soap, and you're gonna rub it for at least 15 seconds to make sure that you get all the crevices so we're not getting any bacteria into your wound. So just keep scrubbing, make sure you get the fingernails really good. Then we're gonna rinse her off. So now that we have our hands are nice and clean, we're just gonna shake off a little bit of water. We're gonna get some paper towels. We're just gonna pat them dry. Now we're gonna get this pan nice and ready for the wound. So we're gonna fill it up with a little bit of hot water, not super hot. We're just gonna feel the temp. It's perfect. It's about lukewarm. Just gonna fill it up a little bit. That's perfect. And then we're just gonna put a little bit of soap in it. Alrighty.
So I know Jenna just got all of her supplies ready for you, but I'm going to show you how to wash your wound properly. First, you want to perform hand hygiene. So if your hands are visibly soiled, you want to wash it with water and soap. But if it's not, then I would just use some hand sanitizer and make sure it's fully dry before touching it. I'm going to put on some gloves. That's just for my protection because it's your own wound, or if someone's helping you, if they're washed their hands fine, that's okay. You don't need to wear gloves, okay?
Okay.
And I'm going to put your arm underneath a towel just to keep it at home. You can do this in the sink. It should be fine, okay? So we're going to use some warm water, not hot or cold. Hot can really hurt you and cold can cause discomfort, so I wouldn't do that, okay? But it's just a little bit of mild soap and water, and make sure that you rinse the wound really well after you're done, okay? And now for each swipe of your wound, you're going to use a different part of your towel, okay? Because you don't want to spread bacteria. And open it up, and just make sure you're cleaning the wound really well, okay? Does that feel okay for you?
Mm-hmm.
Perfect. So now that you got it all, we'll wait for that to dry. You can pat dry it too. That's okay. Now, of course, you want to get Band-Aids that are appropriate for your size of wound. Right now, the hospitals has a shortage, so we're going to use Band-Aids that are a little bit too small, but that's okay. We'll make do with what we have. And you can get your Band-Aids from like CVS.
Okay.
They sell some good Band-Aids. Do you have any questions for me while I'm doing this?
So sorry, you said it was hot water?
No, so I would use some lukewarm water. You can hurt yourself with some hot water, okay?
Okay. is there any restrictions on my exercise at all?
Yeah, so I wouldn't go swimming with it just because you don't want to expose it to water for too long. And don't lift anything heavy because strenuous activity could hurt it. But definitely you want to promote movement because that will increase the blood flow to your wound and help it heal, okay?
Okay.
So don't not exercise.
Okay.
Just nothing too hard.
When you finish the procedure, remember the universal steps that apply with all procedures. For example, leave the patient in a safe, comfortable position with the call device within easy reach.
I'm Mr. Smith, so it looks like you're headed out of here right now, and we showed you how to wash your wound and everything, and now we're just gonna give you this pamphlet and go over some signs and symptoms of if it looks infected or if you need to call us, okay? So here's the wound pamphlet, and Katie will go over that with you.
So if your wound looks red or if it's itching, if you have any discharge that looks pussy or gross, that's definitely a sign that you need to come in. Because you have the pamphlet and you can show that to your family too, they can help you to look at the wound. Of course, you're going to have a little bit of redness because it's healing, but if it's feeling hot or painful to touch too, that's definitely a sign that there might be infection. So you should come back and get some additional medical care.
Okay.
Alrighty, and can you just show us, can you just walk us through how to wash your wound for us and then just some signs and symptoms?
So some mild water temperature and soap.
Yep.
You go in just streaks up and down without using the same part of the washcloth.
Yep.
And then for infection, if there's any like pussy drainage, redness, or swelling, I should call you.
Perfect.
Yeah, that's
Sounds
perfect. Good job, Mr. Smith. Thanks for coming in and letting us help you.
Thank you for helping me. I
No
appreciate
problem.
Just don't trip on a bicycle again.
it. I'll try.
In conclusion, our group successfully provided patient education on wound care to Mr. Smith, an 80-year-old man who sustained a skin tear on his right forearm. We demonstrated therapeutic communication skills by actively engaging Mr. Smith in the learning process and tailoring our education to his unique needs and health literacy level. By doing so, we promoted a patient-centered approach to care that empowers Mr. Smith to take an active role in his healing process and prevent potential complications. Our group's efforts were focused on providing safe, effective, and patient-centered care to Mr. Smith. By working together as a team and applying our knowledge and skills from previous courses and experiences, we were able to deliver the education in a clear and concise manner that Mr. Smith could easily understand. We hope that our education will not only help Mr. Smith heal properly, but also promote his overall health and well-being. Thank you for watching.